bicycling really serves as a early and primary form of exercise for most post-surgical knees and hips within reason. With regards to the use of Excy, one of the early things we teach our people with the use of bicycle is gentle rhythmic motions through a range of motion that's reasonable. So for example, if you had a right knee injury, we would start you down here at our most extended position, right down here, and then we would just gently bring the leg up into a little bit of a stretch, and then you can, if okay, push back down, down in through this range of motion, then back up into what feels like a comfortable stretch, and then back around.
And
now,
using this
yeah,
leg.
so our non-surgical leg is doing the driving. This is going along for the ride.
Okay.
So this is critical movement and motion for post-surgical care for many reasons. Now, as one gets better, as the stretching, as the motion does its thing, then we'll be able to go a little bit farther. So maybe go a little farther up, and you come in and hold it, and then maybe one day it just goes all the way around, and away you go.
That lovely moment when that happens.
Yeah, it's a big deal.
Yeah, it is a big deal.
I've had people cry. I mean, it is a big deal.
Yeah.
I mean, I get kind of, I think back at people who did that, and it's a big deal. So when you are doing this motion, you know, this is a nice, easy way of moving back and forth. And really the great thing about Excy, particularly for these post-surgical moments, is the cranks aren't super long. And that's really important because we do then truly get easier ability to get through a range of motion, which is, you know, if we can start to pedal sooner than later, that helps with the whole healing of the muscles, improvement of the vasodynamics within the leg, improvement in scar mobility around the knee. So there's so many things that go well with the use of the cycling motion from the post-surgical knee for sure. With the hip, sometimes you have to be careful depending on the procedure, but for say like a total hip, great motion. Sometimes surgeons have their precautions based on their protocols or the conditions of the clients, but in general, the recumbent position can be very nice for redeveloping that early range of motion, particularly on the hip. Again, with our shorter crank on this, it's really awesome because it means you don't have to come as far up through the top part of the pedal stroke to get through that motion. So it'll be far more appropriate for that person who has the hip or knee surgery.
We oftentimes will see on the hip side, people's preference is to start here on the ground because it's hard to get up in that full recumbent position.
Yes.
But on the knee, oftentimes it's in the recumbent.
Well, yeah, so that's right, that's correct. For the knee, the best place is the recumbent position. And partially because as you're sitting here in this chair, we talked about postures and positions earlier. What I want when I have a person rehabilitate the knee is I want them to create pure planar flexion and extension. So as they come up, they're coming straight up and then straight back. So if they're on an upright bicycle, they can have an easier time of cheating that motion, if you will. So they might be like, oh, look at me, I'm going all the way around. So I'm kind of doing this motion back and forth. Whereas when you're in this chair, it keeps you from cheating that motion, and it keeps you more, we'll say, true to the motion we're trying to develop. Because frankly, if you move the leg in a less than optimal way in that early scar development, you know, that can affect how the process goes. So when we try to resume these patterns of motion, we first and foremost try to get this motion around more of a pure planar motion pattern rather than developing bad habits.
Got it.